If you're alone and experience a crushing sensation in your chest, time is your most critical adversary. While calling 911 is the immediate first step, an ambulance typically takes 8 to 12 minutes to arrive. During this crucial interval, your heart muscle is sustaining damage. You might assume that swallowing an aspirin is the solution, but it isn't, as it takes 40 minutes to become effective. We're going to demonstrate a chemical bypass technique that reaches your bloodstream in just 5 minutes. A study published in the American Journal of Emergency Medicine analyzed cardiac events, revealing that patients who took specific, strategic actions before paramedics arrived dramatically increased their chances of survival, sometimes doubling or tripling them. We've distilled essential information into a combat-tested protocol. 6 precise steps to enhance your survival probability. Let's begin. Protocol number 6, the logistics. We start with logistics, because if emergency medical personnel cannot reach you, it complicates everything. Imagine you've successfully called 911, and the ambulance is rushing to your street, paramedics prepared. However, upon arrival, they encounter a locked front door. A review of emergency response logs in major metropolitan areas indicated that forced entry delays, the time required for fire or police to breach a door, add an average of 4 to 7 minutes to patient contact time. In cardiology, 4 minutes is an eternity. It can be the difference between a stunned heart and a permanently scarred one. This brings us to the lighthouse strategy. The instant you feel that crushing chest pain, before your legs give way, you must unlock your front door. Don't just unlock it, crack it open slightly. If you have a screen door, prop it open with an item like a shoe, a book, or a chair. This is priority number 1 because gravity is your enemy. As your heart struggles, your blood pressure will drop, and if you faint, you'll likely be on the floor, unable to answer the doorbell. If the door is locked, paramedics must wait for the fire department to arrive with a Halligan tool to force entry. That noise, chaos, and delay are precious seconds you don't have. We're taking this a step further. You need to signal that your home is an emergency scene. Turn on your porch light and every light in your living room and hallway. You need to distinguish your home from the other houses on the block. Ambulance crews are trained to look for the brightest house, serving as a visual target, allowing them to find you without needing to check house numbers in the dark. If you live in a secure apartment complex, this becomes more challenging. Call 911, then immediately contact a neighbor or building manager to meet the ambulance in the lobby. Do not allow a security gate to hinder timely help. Protocol 5, aspirin. You've likely heard of taking aspirin, but the specific way you ingest it is key to its survival advantage. To understand this, you must understand the underlying problem. A heart attack is essentially a plumbing disaster. A plaque deposit in an artery ruptures, and your body, in an attempt to heal it, sends blood cells called platelets to the site. These platelets behave like sticky Velcro, clumping together to form a dam that completely blocks the flow of oxygen-rich blood to your heart muscle. You need to dissolve that Velcro immediately. A clinical trial at the University of Texas Southwestern Medical Center compared aspirin absorption rates and found a significant difference based on the ingestion method. Swallowing a pill is like waiting for an ice cube to melt in a cold room. It's slow. It takes approximately 20 to 40 minutes for a swallowed pill to travel down your esophagus, dissolve in stomach acid, and enter your bloodstream. During a cardiac event, you don't have 40 minutes. Heart muscle begins to die permanently after 20 minutes of oxygen deprivation. You need to perform a chemical bypass. You must chew the aspirin. By chewing a standard 325 milligrams non-coated aspirin, or 481 milligrams baby aspirins, you break it into microparticles. More importantly, this allows the medication to mix with your saliva and absorb directly through the mucous membranes in your mouth and throat. Researchers found that chewed aspirin inhibits platelets, the sticky cells causing the clot, in as little as 5 minutes. Swallowed aspirin took nearly 3 times as long to achieve the same effect. The texture will be chalky and the taste will be bitter, which can be unpleasant. Don't focus on the taste. Chew it into a fine paste and then swallow it, unless you have a known severe allergy to aspirin. This 325 milligrams dose is the single most effective chemical intervention you can administer to yourself. Protocol 4, nitroglycerin. This is a point most people overlook, and it's critical to understand if you've been prescribed it or have access to it. This is the nitroglycerin protocol. While aspirin prevents the clot from enlarging, nitroglycerin works directly on the blood vessels themselves. Imagine your arteries as a highway, and the clot as a car crash blocking all lanes. Aspirin stops more cars from colliding, but nitroglycerin actually widens the highway, adding extra lanes so blood can bypass the obstruction. Nitroglycerin is a potent vasodilator. It relaxes the smooth muscles in your blood vessel walls, opening them up to reduce the heart's workload and improve blood flow. However, there's a strict protocol for its safe use. A study in the Journal of the American College of Cardiology highlighted that improper use can cause blood pressure to plummet, leading to fainting. Here's the 3-step nitro rule. First, a crucial aspect regarding posture. Never take nitroglycerin while standing. It rapidly lowers blood pressure, and if you are upright, you will likely faint, fall, and potentially hit your head. Immediately sit down before taking it. Second, regarding placement, do not swallow it. Place 1 tablet or 1 spray under your tongue. The area beneath your tongue is rich in capillaries, allowing the drug to enter your bloodstream within seconds. If swallowed, stomach acid will destroy its effectiveness. You should feel a slight burning or tingling sensation under your tongue. If you don't, your medication might be expired. Third, the 5-minute loop. Wait exactly 5 minutes. If the pain persists, take a second dose. Wait another 5 minutes. If the pain still lingers, take a third dose. Do not exceed 3 doses. If 3 doses haven't relieved the pain, the blockage is severe and you require immediate ambulance care. Critical warning: this is a life or death situation. If you have taken any erectile dysfunction medication, such as Viagra, Cialis, or Levitra, within the last 24 to 48 hours, do not take nitroglycerin. The combination of these 2 drugs causes a catastrophic and often fatal drop in blood pressure. This is not a situation to take lightly. It's a chemical incompatibility. If you are on these medications, stick to aspirin and await the paramedics. Next, protocol number 3 is posture. Once the chemical intervention is underway, you must adjust the physics of your blood flow. When feeling weak or dizzy, people instinctively lie flat on the floor or a bed. This can be a potentially fatal error. When you lie flat, gravity evenly distributes your blood volume throughout your body. While this might sound beneficial, during a heart attack, it floods your chest cavity with volume, increasing what cardiologists call preload, the pressure stretching the heart chambers. Imagine your heart as a pump, struggling to perform its function. If you lie flat, gravity makes it easier for blood to return to the heart, but it significantly hinders a compromised heart's ability to pump that blood back out. This creates a traffic jam in your chest, known as preload. By sitting up, you utilize gravity to keep some of that blood volume in your lower body, providing your heart with a much-needed reprieve. Most importantly, sitting upright allows your lungs to fully expand, ensuring maximum oxygen intake while your heart is under stress. You need to reduce the workload on the heart. We recommend a technique called the W position. The action plan: sit on the floor, not on a chair, as you could fall if you faint. Lean your back against a wall, a sofa, or a sturdy bed frame so your torso is at a 45-degree angle. Now, for the crucial part, bend your knees upward and keep your feet flat on the floor. Your legs should form a W shape with your body. Why this specific shape? First, it uses gravity to pool some blood in your legs, slightly reducing the amount returning to the heart, thereby lowering stress on the heart muscle. Second, and equally important, it allows your diaphragm to descend. When you lie flat, your stomach and liver press against your lungs, making breathing difficult. Sitting up opens the chest cavity, enabling maximum oxygen intake with minimal effort. A study in a European respiratory journal monitored oxygen saturation in patients with respiratory distress and found that those in this semi-seated position maintained significantly higher oxygen levels than those lying supine. Protocol 2. Breathing. Now that you are correctly positioned, we must address the panic loop. When chest pain strikes, your brain's amygdala triggers a fight or flight response, leading to short, rapid, shallow breaths, hyperventilation. Here's the problem. Hyperventilation constricts your blood vessels. At the precise moment your heart is starved for oxygen, your panic is narrowing the pathways that deliver it. You are inadvertently strangling your own heart. You must manually override your nervous system by engaging the parasympathetic brakes. We rely on a biologically rooted technique involving the vagus nerve. The vagus nerve extends from your brainstem to your abdomen and acts as a direct brake pedal for your heart rate. You can stimulate this nerve through a specific breathing pattern. The action plan. Forget the paper bag. That's for anxiety, not a heart attack. Instead, concentrate on the out-breath. Inhale gently through your nose for a 4-second count, focusing on expanding your abdomen, not your shoulders. Hold that breath for 2 seconds. Then, exhale with force through pursed lips, as if blowing through a very narrow straw for an 8-second count. The key element here is the ratio. Your exhalation must be longer than your inhalation. When you extend your exhale against the resistance of your lips, it generates positive pressure within your lungs. This pressure activates the vagus nerve, which in turn releases acetylcholine, a chemical signal that prompts your heart to decelerate and relax. Consider the case of a 62-year-old teacher in Oregon. When she experienced chest pain while alone, she recalled a yoga technique involving rhythmic breathing. By the time paramedics arrived, her heart rate was elevated but stable, and her blood pressure had not soared to critical levels. The emergency physicians remarked that her capacity to remain composed and regulate her breathing likely prevented the clot from completely blocking the artery during those vital waiting minutes. Protocol number 1, the data tattoo. This final piece of advice is an additional survival tip that is rarely discussed. It's the critical variable. There's a class of medications known as thrombolytics, frequently called clot busters. These powerful drugs can dissolve a clot in your heart, restoring blood flow almost instantly and potentially averting any lasting damage. However, they carry a significant risk of bleeding. Due to this risk, doctors are bound by a strict, FDA-approved time window. They can generally only administer these drugs if symptoms began within a specific number of hours. If you arrive at the hospital confused, drifting in and out of consciousness, and unable to state when your pain started, medical professionals may be legally and ethically unable to provide you with this life-saving medication. You must record the time of symptom onset. We have equipped you with the scientific understanding and provided you with the protocols. Now, it is your responsibility to ensure this knowledge remains accessible. If you found this life-saving breakdown valuable, please like the video.
This video is for educational purposes only and isn't medical advice. If you have any medical conditions or take prescription medications, please talk to your doctor before making any changes.